November 2014, she was National Coordinator of Healthy Planet UK, and as if all this wasn't enough, she is currently in her final year of medical school with exams looming, but she's spared a day to come address us now, and it's my great pleasure to welcome her to the stage. Isobel Braithwaite.
Hi everyone, great to be here with you all, and I hope that you're managing to stay warm. I'm wearing my coat because it also allows me to put this thing on. But I'm going to talk to you today about sort of climate and health and try and not overlap too much with what's already been said, and then start to think about what can we as students actually do about this, and a few examples from things I've been involved in. So I want you to just first off kind of think in your mind, Ilan's already mentioned a few things like droughts and floods, but what do you think of when you think of the words health and climate change in the same sentence? I guess a lot of people might think of malaria, but do you have any other ideas? And you can, if you want to shout them out, go for it. But here's a few things. So floods, that's been mentioned. Now, for a long time, we've not really been able to say climate change is linked to any given event. It's always about the long-term trend. It's always about probabilities. Scientists are now starting to actually be able to work out whether climate change might have contributed to something happening. It's still in probabilistic terms, but they think, they've done that around floods that happened in Scotland quite recently and came up with a figure of 40% more likely because of climate change. So as we're starting to see more and more of these things happening, both here in the UK and also sort of around the world, I guess that's one of the things which is going to be changing is in terms of our understanding and actually linking potentially individual events to climate change and how that will change people's perceptions. One of them is obviously disasters more broadly and the many, many different health impacts that has on people. So it's not just if you get injured or killed during the disaster, it's not just if it disrupts your water supply or your sanitation, but it's actually also the long-term effects if your house is damaged, if it becomes mouldy and damp. The fact that if your insurance refuses to pay out on it, what's that going to mean for your kind of financial stability and your ability to keep affording your basic essentials? And then what does that do to mental health in the long term? So this can apply to floods or wildfires or droughts, lots of different things. But one of the key things I think to bear in mind with that is that the impact of the floods here over Christmas, regardless of whether or not they're linked to climate change, is very, very different than the floods that happened in Chennai just a bit before that. So you've got people there living in slums, and actually what's almost worse in terms of the impact that that has on people is that the government then decides to stop people from being allowed to live there because they say, okay, this is not a safe area, you will have to move. But they don't say, we will help you. They just turf them off that land, and that might reduce deaths from floods in future, but it means those people are now homeless, which is probably worse in the short term at least. So that's kind of a whole order of magnitude different than what happened in the UK, and that was really bad enough. So another example is El Nino, which is basically a sort of long-term fluctuation in the climate system over about 5 years or so, where you get oscillations and you get sort of hotter periods with less rainfall in some areas and then also more in others, and you get an increase in extreme weather, and one of the consequences that has is less food being produced and more people going hungry. That's not a straightforward climate health link. What it actually means is it's dependent on people's pre-existing levels of income. It depends on the social protection that's in place. It depends on whether there's aid available, who gets access to that if it does come, and what skills and other options do people have if they can't make enough from farming the land? Can they go somewhere else? Can they work in something else to keep their family afloat? And again, that's really different if you're poor, if you're from a much poorer part of the world than if you're in the UK, say. Zika, I thought, was quite topical, and I guess you might have seen that there was a bit of kind of discussion about whether or not Zika was linked to climate change or what might the links be. Bottom line of that is that there's no evidence as yet to link it, except in that the mosquito vector is the same one, Aedes aegypti, as dengue fever, and we do know that there is a bit of a link between the rise of dengue and climate change. I guess the point here is more that climate change is expected to cause infectious diseases to spread to new places and affect more people, and potentially also new infectious diseases to kind of spread more easily as the climate changes, as it becomes more unpredictable. So it's not really that we know whether or not Zika might be partly driven by climate change, but it's maybe the kind of thing that we might see more of in the future because of climate change. So this was a number of years ago now. It was around the Copenhagen climate talks that the Lancet did this, but they've actually done a second commission on climate and health just last year, which I'd recommend trying to look up if you want to find out a bit more. But they came out and said climate change is the biggest health threat of the 21st century. And the message of the one that's just come out was actually that climate change could be the greatest health opportunity of the 21st century. So that's for all the reasons that Ilan mentioned in terms of all the things that we need to do to tackle climate change make sense in their own right. They make sense for health, they make sense for human rights and for development. And they're pretty much spread right across the SDGs. So I'm going to try and illustrate that. So that didn't really come out properly. But that's some of the kind of categories of health impacts that are linked with climate change. So this is a little bit about the many different factors that end up sort of modulating the way that a changing climate translates into different health outcomes, and often worse health outcomes. And all of these things are threaded through the idea of sustainable development. So I think it's really just to say, like, you can't treat it doesn't make sense to treat it as a separate thing. It's very much the same set of issues and the same challenge as achieving sustainable development, which with 169 targets is not a small thing. But just to sort of try and highlight the interlinkage, really. This is slightly out of date, but it's a map of global emissions. It's a cartogram, so the area is proportional. Sorry, this is not emissions, this is mortality related to climate change, and that's the WHO's way of calculating it. The figures are from 2000, but clearly what you can see is the poorest parts of the world are the worst hit in terms of climate impacts, and a large proportion of that is to do with malnutrition as one of the biggest ones. But that contrasts with the I think they're meant to have multiple, but basically the other image that should be there is exactly the opposite. It's where the emissions are. So you've got a giant Europe and a giant North America, and it's precisely the other way around, basically. It's worth just Googling it or something later. But it's a very stark contrast between who's producing the emissions and the fact that we've developed and become richer partly through the way that through those emissions, and who's actually bearing the brunt of that because they're poorer and therefore less able to cope with it. So this Ilan's already alluded to. Green spaces, great for health, get people moving, and also really good for mental health, reduce stress. Diet, it's not to say that everyone has to go vegetarian, because a lot of people don't really want to, but it could just be eating a bit less meat. It It could be eating less red meat and sort of shifting towards white meat or something, and those things can actually significantly reduce people's carbon footprint because it's a thing you do every day. So I'm not saying it's equivalent to stopping flying. It's more just that it's worth thinking about those things, because even if, I think a lot of people think, oh, I can never be veggie or something, but actually a lot of people that I know have decided to stop eating meat one day a week, or they'll only do it, certain days or something like that, and that over your whole lifetime has a big impact. So it's just starting to think about those things. Transport, there's been loads and loads of studies looking at cycling and making cities more pedestrian friendly. I know that Bristol won like Sustainable City of the Year or something, but Bristol's quite good for this. And the point about this is, if you walk and cycle more, and if you can build your cities in that way, then not only are you helping people to be healthier and you're reducing air pollution, but you're actually also reducing climate emissions at the same time and saving money because people are healthy. So these are some of the targets from the SDGs that I think are particularly relevant to climate and health, but it does kind of cut across a lot of them. So there's one there from the health section, which mentions air pollution. Anyone guess how many people die every year because of air pollution? It's more than 1 million, so I'll give you a clue.
2 million.
Up. Down.
6 million.
It's 7 million was the figure that the WHO came out with. So it's quite a lot of people. It's apparently approximately 1 in every 8 deaths worldwide. And most of those don't get recognised as air pollution deaths because it's just one factor amongst many, like smoking and things. But it causes asthma, COPD, heart disease, stroke, lots and lots of different health problems. And one of the big ways that we can reduce that, as well as the active transport bit, is moving towards renewables. So, transport, air quality, green spaces, these all come up in the SDGs, not with reference to climate change. And the sort of quality of our economic growth as well. The idea that should be decoupled from producing emissions. Then the specific climate ones, this is, sort of a bit odd that they kept them out separate, I think, and something to do with the way that the SDG process relates to the UNFCCC process and sort of trying to integrate those when they had their own outcome documents, I think is a bit difficult. And I'm not sure that they've really managed to weave it right through. So this is just drawing some parallels between, it's come up a bit weird, between the sort of paradigms of climate change and global health, and it's a little bit like the differences with disaster risk reduction. But I think there's a sort of tradition in global health that has maybe come a bit more from medical first response to disasters and things like MSF, and also WHO's various different campaigns and things, which has tended to be a bit more of like a rapid response type of thing, and maybe a little bit more focused on individuals rather than populations. Whereas climate change starts with this very long-term view, and it started, I think, much more from environmentalism. And I think what's happened is that they've both kind of converged so that actually this is much, much blurrier now, and the climate thing has become a lot more about the impacts on people, whilst global health has started to really recognise how much it's impacted on by all these different social and environmental determinants of health. So I think that is no longer kind of true. And this is just an illustration of that from a conference that the WHO had last year, where you've got some children of all the different WHO staff members, because they decided to make their conference all about climate change and health, and to get lots of ministers there. So what can we do? educate yourselves, learn more, like find out about the issues, go to talks, read stuff online. There's loads of great resources out there on the internet that are just free to access for everyone. Teach other people. You can run workshops, you can try and get stuff into your curriculum at med school. Like just keep badgering them to teach you more about some of this stuff and teach other people. I think is one of the important things. That's some students from the IFMSA doing a webinar. And because we don't get taught anything about this, you don't have to actually kind of study for ages to know enough that you can like get people interested in it, which is probably the most important thing. Because then they can go and teach themselves. This is just to say that, maybe it's not enough to just be aware of things if you don't do anything about it. So Eleanor, who's over in the corner, is coordinator of Healthy Planet now, and doing a really great job. And get involved with them, or if there's local groups at your university, maybe groups that are campaigning fossil fuel divestment, groups that are trying to deal with climate change in their own way, that would be a cool way to get involved. There's lots and lots of stuff out there, and I would say probably my advice would be to try and find out what's going on and try and see how you do our red lines, and we need some of these, we need governments to step up basically and make sure that they tackle this in a fair way that's really going to protect people. A little bit about divestment, I'll skip through that because I need to finish. But it's definitely a big issue, and at the moment governments are still investing lots and lots in subsidising fossil fuels and in finding new ones, and not nearly enough in renewables. But actually so are our universities, so they are mostly still investing in BP and Shell, and I think we need to say to them, this is really bad for health, you don't invest in tobacco anymore, so why are you investing in climate change? It doesn't make